Today we're speaking with Thabani Maphosa, the Managing Director for Country Programs with GAVI. He's based in Geneva, and we're looking forward to getting his insight on some of the broader ways the world must brace itself in the midst of a global pandemic. The first question we have for him is, what issues are emerging as COVID-19 consumes resources around the world? What have the ripple effects been, and what is GAVI doing to continue your important work?
Thank you very much. I think that the first resource that we have seen impacted by this crisis as it relates to GAVI work specifically is actually the human resources that we use to deliver immunization on the front line. They have been diverted to respond to COVID. And what that means is that we have less people to be dealing with the other vaccine preventable diseases that we normally would respond to using these human resources. Then the second one is that countries are diverting their own financial resources and donors as well are diverting their financial resources to confront COVID-19. This means that for countries that normally contribute to the running of their own programs, countries that have a very narrow fiscal space, they will be challenged as we come out of this situation. They will find themselves having been able to probably respond, but yet having been set back in a significant way in terms of their own programs.
Is there anything specifically that GAVI is doing right now to combat these issues or work around them, or what are you seeing as some of the solutions?
Some of these are very difficult. Diverted health workers are difficult to, you can't ramp up that fast in that particular area. But one area that we could probably try to respond to and that we are responding to is making sure that the health workers have got the right protective personal equipment so that they can show up for work. This is important to protect them and to protect the families that they are helping. WHO has issued some guidelines of essential health services that have to be sustained during this period, and immunization is one of those services that can be sustained. But with some of the measures that have been taken in a number of countries in the form of lockdowns and restricted movement and physical distancing, it is a little bit difficult to actually get the health-seeking behaviors at this particular point. And so for GAVI, we have now started thinking post-pandemic in terms of the recovery phase to say, if there are things that we can't do now, what can we then do at that particular point as soon as the situation allows? And so we are thinking about catch-up campaigns that may need to be done to make sure that we catch up with populations that have been missed. But we are also beginning to think about COVID itself. If it does get to have a vaccine, how do we make sure that that is rolled out as well?
Okay, great. And I don't know if you want to talk a little bit about the GAVI replenishment that's happening and what this means for that you're looking at basically a diversion of resources at a time maybe whenever you're going to need to be ramping up and maybe even adding another vaccine to the list of vaccines that you distribute.
True. Thank you for that question. I think that for the replenishment, sad as it may be, the message and the bigger narrative here is that never has vaccines and the work that GAVI do been so important to the world. When you look at the economic losses, when you look at the impact at a global scale that has been caused by this pandemic, you realize that GAVI, through its work, has actually prevented us up to this particular point from being exactly in the situation where we are in. So one would say that during a replenishment period, the role and the work of GAVI has never been so profiled and brought to the top to actually understand that this is one tool that has been extremely helpful up to this particular point. It is important for me to talk about DRC, for instance, when we talk about this situation. While we responded to the Ebola, one thing that we realized was actually measles was killing more children than Ebola was. Yes, Ebola was a global health security if it was going to be crossing borders, but the number of children that were dying through measles was manifold. The number of people who were dying through Ebola. This is not to discount the value of life. Any life that is lost, it is a life that leaves our hearts broken. But when you really think about the impact and what a view of what GAVI has been doing to keep yellow fever at bay, to keep measles at bay, to keep meningitis at bay, you realize that it has been a significant contribution that can no longer be discounted or be left to be invisible and be on the back burner. At this particular season, it has got to be understood more that as a public good, it is something that has been extremely relevant and necessary.
Okay, great. Yeah, and I think that kind of leads into the next question really well, which is, how are you seeing women and children impacted specifically by this global pandemic? Especially maybe, you know, along the lines of what you're talking about in DRC, that that the impact is different than you might imagine.
Sure. Let me talk about women because I have a 13-year-old daughter in my house. And the reason I begin there is that she's at that age that she should be qualifying for HPV as a vaccine. And as we know, the burden of cervical cancer in Africa is extremely high. With the children out of school and the girl child in particular, it means that we may have children who actually miss the vaccine or the vaccination, the immunization for HPV. I spoke about my daughter very specifically. She's 13. If she doesn't get HPV, or if she were in Africa and she didn't get HPV in the next few months and this protracted a little bit longer, the cutoff point for girls to be getting HPV is about 14 years of age. So it means those children who are actually on the edge may actually miss that vaccine. And if they do miss that vaccine, it actually is the number of girls who then will live with the risk of cervical cancer visiting them at some point in life, whereby a vaccine would have actually mitigated that for them. Then we started with the health workers. When you think about the frontline health workers, 70% of our global health workforce is women. We have seen in Italy, we have seen across the world that the people who are facing the brunt of this, our real heroes, are our health workers. And if 70% of the health workers are actually women, you can already see that in the health workforce, they are going to be impacted in that regard because they are exposed. They are on the front line of dealing with COVID. Then you go into the caregiving space. I work with a lot of women who have young children, and whether I'm speaking to friends who are here in Geneva or friends who are in Washington, DC, or friends who are in Johannesburg, South Africa, everybody is telling me how difficult it is to be a mother during these times, where you have got to be thinking about your own work, especially for working mothers, but you also have got to be thinking about taking care of the family. The burden is higher even at a caregiving space for a working mother. There is something that has always been well known. These situations and events, they have a disproportionate effect on women who are uneducated, who are poor, and COVID is going to be the same. it is going to make it very difficult. I'll give you an example of the situation that is happening right now in Zimbabwe, in South Africa, in DRC. When you lock up a woman or you institute a lockdown, and a mother who has got children, who always is looking for her daily bread on an everyday basis, is locked up, and they have no income to find food, that sends them into a very desperate and a very vulnerable situation. So women broadly, in specific and general terms, are taking the biggest brunt of this situation.
Thank you for kind of going through that for us. And I wanted to clarify partly, whenever you spoke, you said whenever, if you were talking about HPV, saying getting HPV, you meant the vaccine.
That's correct.
Yeah.
Yes, human papilloma vaccine.
Right. Okay. So the last question is, I think that GAVI must have a lot of lessons learned from past experience. And I'm wondering if you want to talk a little bit about that and where there might be resources for people to go and look from lessons learned and specific country examples, maybe.
Sure. Well, our website, for starters, is a good place to go. There is a lot of information there. I continue to dig through some of it, and I have not gotten to the bottom of that pit. So I would encourage people to visit gavi.org and look at some of our resources in that space. But one thing that as GAVI we have, and that we are going to learn in this particular situation, is in terms of the response itself. We are doing a lot in releasing some of our resources to make sure that governments are prepared to help with testing, to support with protective personal equipment. We are also looking at communication, community mobilization, and making sure that the message gets out there in the simplest and most understandable ways, leveraging our broader network, which not only involves the private sector, but also has got the UN and has got civil society, making sure that we play to the advantage of any and every bit of our alliance to reach out to where we need to reach out. Last but not least, the vaccine is one sure way of responding decisively to COVID-19. And if that is the case, GAVI is very well placed to be able to support and advocate for a vaccine that can be accessible for everyone across the globe. This should not be a vaccine that is accessed only by those who are rich, but it should be a vaccine that really speaks to the fundamentals of how GAVI was founded, which is equitable access to healthcare and specifically immunization. And so GAVI has already geared up its machinery to make sure that it is involved in the conversations around vaccine development, and to make sure that when we get to that production, this vaccine is one that is accessible to everybody across the world as best as is possible.
Okay, I think that those are two really important points. The equitable access to the vaccine, and then also the communication, how you need to work with the community to actually roll that out. And those are definitely places where GAVI has expertise. So thank you so much. If you have anything else you'd like to add, please let me know. But otherwise, really appreciate you spending a little bit of time with us this morning or your afternoon.
Thank you very much. And just want to appreciate the work that you do as well. It is not just important for our routine work, but it is also important for the system.